Great. Thank you, everybody, for being here. My name is Stuart Schlossman. I'm president and founder of MS Views and News. I, too, have multiple sclerosis, and that's another story in itself. For those that don't know me, well, you'll have to join our events as we go forward, and then you'll get to know more about me and the things that we do. Today's program is sponsored by Bristol-Myers Squibb, and internationally, we want to give them a virtual round of applause, all right? I want to thank everybody for being here and thanking them for, helping us to do today's program. Today's speakers, we will have Dr. Ashwin Mehta, and Dr. Ashwin Mehta is a integrative medicine doctor. We have Dr. Jessica Beatty. Dr. Beatty is an MS neurologist. We have Trevor Wicken. Trevor Wicken is a fitness expert. And then we have Marilyn Volker, who's a sexologist. You probably have seen the topics for this, but if not, you'll hear about them one by one as we get started. So again, today's program, this is about wellness, all right? This is the MS Wellness Summit. We do this periodically. This MS Summit was developed with this important message in mind. Today, more than ever, there is research and new evidence supporting that practicing different avenues of wellness can improve how a person feels daily. Yes, daily, okay? We hope that this event brings you new ideas, inspiration, and resources that will help to improve your health and wellness. And so today, again, I do want to welcome everybody from around the world. Again, we are doing this as an international program. We had almost 600 people register for today's event, which is absolutely awesome. All right. Today's program, again, it's an MS Views and News program. And I, as president and founder of MS Views and News, greatly appreciate everybody that's online, as well as our presenters. I'm thanking them right now for doing what they are doing, because we have different topics and each presenter is going to speak for a certain length of time, most of them speaking for 30 minutes each. All right. And then we're doing Q&As with each one. And there is the esteemed, very well known in South Florida, primarily, is Dr. Ashwin Mehta. He's trained as a fellow in the program of integrative medicine at the University of Arizona and is board certified in internal medicine and sleep. He served as the co-conference chair for the International Society for Integrative Oncology in 2016, and his expertise includes nutrition, exercise, sleep, yoga, and mindfulness to achieve wellness in the context of coping with chronic medical conditions. I'm not going to keep reading. I'm going to let Dr. Mehta get started, and he will speak for 30 minutes, and then I will come back on to do the Q&A, right? So take it away, Dr. Mehta.
Thank you, Stuart. I appreciate your kind introduction and also your invitation to share this presentation regarding a subject that is very near and dear to me. I appreciate the Scientific Review Committee requesting me to be with you all today. And my talk is going to be about integrative health in the context of living beyond multiple sclerosis. As Stuart mentioned, I'm the medical director for integrative health at Memorial Healthcare System, which is in Broward County, South Florida. And I have the true privilege of combining the wisdom of ancient healing traditions in a very holistic way, and combining those with modern medical technologies to really provide the optimal outcome for patients whom I care for. So my objectives are going to be, number one, to define integrative medicine. There's a lot of misconceptions out there about how integrative medicine, how it's different from alternative medicine. And so I'll talk a little bit about that. I'm going to be describing the role of integrative medicine in the non-pharmacologic management of multiple sclerosis. What can we be doing day to day, week to week, month to month to actually manage our health in a more positive direction? Interestingly, our positive health behaviors have such a tremendous impact. So to the degree that we can empower our patients to engage in these positive health behaviors, to that degree, we really can improve outcomes when living beyond multiple sclerosis. I'm also going to be sharing the evidence for nutrition, for exercise, for mindfulness, good sleep practices, acupuncture, and yoga for optimal brain health. Moving forward. So this is very much a consumer-driven movement. What is integrative medicine, and why is it important to talk about? Well, interestingly, many Americans, nearly 40%, use healthcare approaches developed outside of mainstream Western or conventional medicine. for specific conditions or overall well-being. So this is very much a consumer-driven movement. Moving forward. How is integrative medicine different from alternative medicine? Well, integrative medicine is very much a complementary approach. Complementary generally refers to using a non-mainstream approach together with conventional medicine. Alternative refers to using a non-mainstream approach in place of conventional medicine. So never will we advocate our patients to forego the standard of care treatment that are being recommended by neurologists. So we actually work shoulder to shoulder with our neurologists in order to address some of the inflammatory consequences of multiple sclerosis to optimize our patients' response to standard of care treatment, to reduce the untoward effects of the medications that they may be using, and overall to improve quality of life in the context of treatment. Moving forward. So what is integrative medicine? Integrative medicine is very much a patient-centered approach. What does that mean? Well, what that means is the first question that I ask my clients is, what are your goals? What do you wish to achieve? During the course of our consultation, what is important to you to prioritize? So it's very much a patient-centered approach. It's very much also a partnership between provider and patient. And we span the spectrum from prevention to active treatment. In other words, when someone is starting a new treatment, we'll do everything we can to engage them in positive health behaviors so that they can effectively manage some of the common side effects of medications. And we also treat those side effects when they arise. And we also make sure that any impact on quality of life from multiple sclerosis itself is mitigated by engaging in these positive health behaviors. We use natural, effective, and non-invasive interventions whenever there's good science to support their use, and we span the spectrum from conventional as well as non-conventional modalities. So this comprises the central pillars of an integrative approach. Moving forward. We engage mind, body, spirit, and community. As we all intuitively know, what happens in our minds impacts our physical health, impacts our bodies. What happens in our bodies impacts our minds. And so to the degree that we can engage the power of the mind in the healing process, to that degree, we are truly embodying an integrative approach. We encourage our providers to model healthy lifestyles for our patients. So I have the very unique ability to share with my patients that there is nothing that I would be recommending for them that I have not tried myself. Our focus and attention is on lifestyle choices for prevention and maintenance of health, and we maintain that healing is always possible. This is a very important affirmation that we use in the palliative care setting. It is healing is always possible. Moving forward. So I'd like to introduce you to Emperor Huang Di. Now, Huang Di was also known as the Yellow Emperor, and he wrote the canon of Chinese medicine in 2600 BC. He was intrigued by this concept that while most animals in nature have very specific diet, human beings can actually, we are omnivores. We can eat anything and everything we want. So he actually empowered his trusted advisors and scientists and medical professionals at that time to use the power of observation to understand what can be done in a preventive way in order to optimize individual health. Now, I oftentimes credit Huang Di as developing the very first healthcare system in the world. And in this healthcare system, you would pay your medical practitioner a stipend every month until you fell unwell. When you became sick, you would stop paying them. So interestingly enough, the emphasis, the motivation was to keep people healthy, to use preventive approaches to preemptively mitigate the untoward effects of different chronic medical conditions. And so interestingly enough, here we are thousands of years later, And we are now back at this point where the value-based reimbursement model, the emphasis on patient satisfaction, on patient's experience, all of these things are incredibly important, and they have contributed substantially to the rise of integrative practices in hospital systems and healthcare environments all over the country and all over the world. Moving forward. So what are some of the symptoms that we see oftentimes with multiple sclerosis? I'd like to share this with you because you see a lot of these symptoms are interrelated. I refer to them as a constellation of symptoms. And so when you have these constellations of symptoms, oftentimes using a sort of pharmacologic approach, it may improve one symptom, but worsen others, which is another reason why the non-pharmacologic integrative approach that uses positive health behaviors in order to address this constellation of interrelated symptoms is oftentimes very, very important. So these symptoms include fatigue, body composition, including weight loss and weight gain, poor sleep quality, mood changes, including depression, anxiety, chronic headaches, neuropathy, neuropathic pain, spasticity-related pain, physical deconditioning, sexual dysfunction, and constipation. So you can kind of see how a lot of these symptoms may be interrelated. My background, I'm a medical doctor by training in internal medicine. My subspecialty area is sleep medicine. So we always begin by describing what happens in our brains when we achieve those deeper, more restorative stages of sleep. During REM sleep, there's a brain and body cooling. Almost every single muscle in the body actually relaxes completely during REM sleep. Right now, if we're seated in a comfortable position, it's almost like our engines are idling. But when we achieve REM sleep, we are actually turning the key and bringing it and turning off the ignition. That is when our engines are allowed to cool. And that is why the brain and body, the core body temperature drops about 1.5 degrees during REM sleep. And that is profoundly beneficial for the brain. It actually is an opportunity for the entire body to reduce the inflammatory burden that we incur during wakefulness. There is an oxidative stress that all of us incur during wakefulness, and that oxidative stress is ameliorated, is relieved during REM sleep. So REM sleep has profound anti-inflammatory effects. Multiple sclerosis, being an autoimmune condition, has oftentimes inflammation as a very underlying foundation of so many of these symptoms. So achieving good sleep and achieving good rest is one of the first things that we do, and one of the best ways that we establish a rapport with our clientele. Oftentimes we are encouraged, nutrition, exercise. It's a very, sometimes it's very challenging to engage in those positive health behaviors if we are not getting a good night's rest. So we start with sleep. We say, what if our immune system can actually be modulated and improved in its functionality if we choose a less is more approach? How about by relaxing and using mindfulness and getting good quality sleep, we can actually begin the process of reducing the inflammatory burden in the brain and in the body and achieve better health overall. So you can see how oftentimes if you're not sleeping well, you may have fatigue. Your pain threshold is actually lower if you're sleep deprived. So many of these, your mood, including anxiety, depression states, may also be impacted if you're sleep deprived or experiencing chronic sleep loss. So getting good sleep is one of the foundations, one of the central pillars of our integrative approach. And when we are able to achieve positive gains in the area of sleep, then we use a stepwise approach that applies nutritional practices and exercise recommendations and mindfulness techniques with the addition of therapeutic yoga, acupuncture, massage therapy in order to improve quality of life for our patients and really unravel this interrelated constellation of symptoms. Moving forward. So we oftentimes broadly categorize the symptoms that we see in these various categories, and there may be some overlap. Some symptoms may be inflammatory in nature. That's hot. Some symptoms may be atrophic. That's cold. Some symptoms may be toxic, sweet. Some symptoms may be vascular, pale. Some symptoms may be traumatic, dazed. And some symptoms may be sleepy or slow. And this is from Dale Bredesen, who actually wrote a protocol called the Recode Protocol for optimal brain health and cognitive slowing. And you know, I credit a lot of his work with some of the non-pharmacologic integrative approaches that we can use for optimal brain health, and we apply these within our protocols to address symptoms experienced in the context of multiple sclerosis and the treatment. Moving forward. So what includes the functional medicine approach to brain health? Well, certainly checking hemoglobin A1C. You noticed previously in the previous slide there was toxic and sweet in the same category. So really modulating blood sugars. And blood sugars, oftentimes people have this misconception that it's all about what we're eating and drinking. Well, yes, that's important, but actually body composition, muscle tone, our basal metabolic rate is very much related to our muscle tone. So to the degree that we can actually improve our muscle tone or prevent any loss of muscle tone, which is so common in MS, is this loss of muscle tone. So muscle acts like a big sponge to blood sugars. So it's important to manage blood sugars and maintain that good lean body mass. And you're going to hear a presentation about exercise in coming up that actually that shows how exercise can be used as medicine in the context of MS. We always apply good sleep screening. So important that people are achieving good restorative stages of sleep. As I mentioned, the importance of REM sleep in the context of addressing MS symptoms. We check homocysteine levels. We check inflammatory markers like C-reactive protein. We do microbiome testing, heavy metal toxicity. We also talk about different fatty acids and our genes that relate to fat metabolism and cholesterol metabolism in our body, including ApoE4, vitamin D. It's vital to keep our vitamin D levels in therapeutic range. Now, interestingly enough, even here in beautiful sunny South Florida, many of us are walking around vitamin D deficient. So we aggressively check for vitamin D levels. We check thyroid functioning. We do hormonal testing as indicated, and certainly we check lipid panels. So these are some of the diagnostic approaches that guide our non-pharmacologic management of symptoms in the context of living beyond multiple sclerosis. Moving forward. So how do we then orchestrate these non-pharmacologic modalities in order to really move the needle in the context of addressing symptoms as well as moving those laboratory parameters that I just described? Well, we start off with an anti-inflammatory nutritional approach. This is a plant-based nutritional approach, which is high in fiber. If I were to summarize our nutritional recommendations, it is as follows. If you look at the standard American plate, we even use that expression, meat and potatoes. Well, meat and potatoes are typically 2/3 or 66% of the standard American plate, and 1/3 are those plant-based foods, the so-called side dishes. So the leafy green vegetables, the cruciferous vegetables, the nuts and seeds, the lentils, the beans, the legumes, all of that is 1/3 on a good day of the standard American plate. And so a plant-based approach actually includes flipping that ratio around. So all of a sudden, 2/3 of what we're eating is plant-based. And what used to be considered the side dish, 1/3 or 33% is the animal protein and the starch. So if I were to summarize my nutritional recommendations, it's really just 10 words. It's less meat, teat, wheat, and sweet, less dairy, less meat, less animal protein, less sugar, and less processed grains. More roots, fruits, leaves, and flowers. Roots are carrots, beets, turnips, radishes, ginger, turmeric. Fruits to your heart's content. Leaves are spinach, kale, green tea. And flowers are the cruciferous vegetables, broccoli, asparagus, Brussels sprouts, cabbage. So 10 words. Less meat, teat, wheat, and sweet. More roots, fruits, leaves, and flowers. Every single client gets an exercise recommendation. We start off with a cardiovascular foundation, upon which we build core body strengthening, and including resistance training exercises, and then flexibility and balance training. Everyone also gets a mindfulness recommendation. Now, mindfulness is a very broad category of practices, and it's important that we find one that works for us, because for these positive health behaviors to really stick to our lifestyle, we have to enjoy them. We have to really appreciate them, the improvements in our quality of life, because we're engaging in these positive health behaviors. I've spoken enough about sleep, but it's incredibly important, and we coach our patients to achieve better quality sleep through sleep hygiene by coming up with appropriate bedtime routines that may include everything from aromatherapy, mindfulness practices, and also the use of relaxing teas and herbs. We have two wonderful acupuncture practitioners at Memorial Health who work shoulder to shoulder with us to address all kinds of symptoms, and they are gifted healers, and we're so delighted to have them at Memorial. We also use massage therapy. I prescribe therapeutic yoga for optimal brain health. We do have music and art therapy programs, as well as individual and group programs. And the whole goal of these programs is to really address this link between inflammation and pain. Wherever there's pain, there's inflammation, and wherever there's inflammation, there's pain. And certainly in the context of MS, so that's the link that we're trying to unravel here. Moving forward. So let food be your medicine. You see here, there's some cruciferous vegetables, there's fruit, there's leafy greens. So roots, fruits, leaves, and flowers are to your heart's content. Next slide, please. So what are some of the nutritional risk reduction strategies? Well, many people come in asking about supplements. Well, we actually take a less is more approach to supplements. Do I prescribe supplements? Absolutely. Do I use them myself in a very judicious way? I absolutely do. However, we want food to be our medicine. So more cruciferous vegetables. Cruciferous vegetables include compounds called indole-3 carbinol. Very, very good for the immune system and reducing inflammation. We use cooked Asian mushrooms, maitake, shiitake, inokidaki, reishi, coriolis, turkey tail, all of lion's mane. All of these mushrooms have very interesting immunomodulatory properties. And immunomodulatory properties are very useful in the context of addressing symptoms related to MS. One Asian mushroom in particular has a compound in it called active hexose correlated compound, AHCC, which is a very unique immunomodulating compound that addresses viral particles in the body. And actually, after 6 months of 3 grams of AHCC, it was found that HPV was eradicated from the human body in preliminary clinical trials. We use curcuminoids, for example, those in ginger and turmeric. Wonderful benefits of the catechins in green tea. EGCG stands for epigallocatechin gallate, and it is a wonderful antioxidant. Combined with L-theanine, green tea is one of my most commonly recommended foods, and not in supplement form, but actually the green tea. Brewing an organic green tea that you enjoy, 1 to 2 cups per day, and this is especially important for those individuals who are copious caffeine drinkers. So it's really important to switch from coffee into green tea for many of my patients. We check vitamin D levels. It's very important to address that proactively. Moving forward. So yoga, I mentioned that we use therapeutic yoga. This is a study that looks at self-reported memory difficulty in cancer survivors, the so-called chemo brain. This was a nationwide randomized clinical trial. And interestingly enough, it found that improving sleep quality was correlated with improving cognitive functioning in these cancer survivors. So it's very important to get good sleep, and one of the best ways of getting good sleep is to use the body breathing techniques that are so common in therapeutic yoga. So in this study, it was found that yoga significantly reduced patient-reported memory difficulty in cancer survivors, and that's one of the reasons that we prescribe yoga also therapeutically for our MS patients. Moving forward. There's also been randomized controlled trials using therapeutic yoga and exercise in multiple sclerosis. So suffice it to say that gentle yoga. Now, it's very important. You know, the type of yoga instruction that we're talking about is therapeutic yoga. This is yoga applied in a very scientific and medical way. And it's not just stretching. This is targeted flexibility training along with deep breathing techniques in order to really optimize cognitive functioning. And that's how we prescribe yoga. We use very gentle yoga postures with an emphasis on breathing and very mild inversion in order to help our MS patients. Next, moving forward. Massage is very useful, and massage is useful in the context of chronic pain and spasticity. So this is a study that looks at how massage improves chronic pain and sleep quality in patients who are living with fibromyalgia. And they found that the mediator here was decreasing substance P levels. So very important to have massage as a complement to standard of care. Moving forward. Now, what are the modulatory effects of acupuncture on brain networks in mild cognitive impairment patients? Well, we find that acupuncture can really be of value. And, you know, interestingly enough, there are genetic predispositions. Sometimes genetically, we are either predisposed to responding to acupuncture or not. So instead of doing these genetic tests, what we do is we do a trial of a few sessions of acupuncture, and if that helps to improve the cognitive functioning, as well as reduce the spasticity-related pain, reduce the inflammation, then great, we can continue that. But if the acupuncture is not working within a few sessions, we actually discourage continued use because we want as much time and energy devoted to these modalities to be as optimally beneficial for our patients. Moving forward. So exercise as medicine. I'll describe this briefly because you're going to hear a wonderful talk by Trevor Wiggin about exercise in the context of multiple sclerosis. But suffice it to say that exercise is one of the best anti-inflammatory practices that we have. So this is a study that was done in cancer survivors looking at how exercise contributes to less fatigue, improving sleep quality, and overall a reduction in inflammatory mediators. Moving forward. So we know now also that these exercise prescriptions are very, very important in the context of MS. This is a multimodal exercise training program in multiple sclerosis, a randomized controlled trial in people with substantial mobility disability. And what they found was 83 participants improved significantly their mobility. This was a supervised multimodal exercise intervention that combined aerobic exercise, resistance, and balance. And there were significant improvements after 6 months in all of these different parameters. Moving forward. Look at the exponential rise in mindfulness and other meditative practices in the context of the research, the body of research and science that we have available. Moving forward. There are wonderful benefits of optimizing mindfulness practices, and this study looked at mindfulness-based stress reduction, MBSR, for people with multiple sclerosis. And what they found was that there was an initially unpleasant experience. Increase in awareness of disability was generally followed by greater acceptance and self-compassion. So oftentimes when our bodies are malfunctioning and not cooperating with us, there is this loss of self-compassion. And mindfulness, one of the wonderful expected benefits of mindfulness practice is this remembrance of self-compassion. How do we achieve that self-love? How do we achieve that resolution, that reconciliation with our bodies is so important as an initial step towards healing. Other benefits included improved relationships, walking and sleep, less stress, and less pain. So MBSR is one modality that has been studied extensively in the context of MS, and it's, again, one of the central pillars of an integrative approach. Moving forward. What are the benefits of mindfulness? Well, certainly there's a reduced burden of psychological symptoms, including less depression and anxiety, improved emotional reactivity, enhanced behavioral regulation, increases in compassion and altruistic behavior, and enhanced attentional skills. Moving forward. How does mindfulness work? Well, we can see here there's wonderful changes. Actually, mind-body practices change the very structure and functioning of the brain. Mindfulness changes brain structure, as demonstrated by this study, which was 8 weeks of a sustained mindfulness practice, which demonstrated increases in gray matter density in several regions of the brain. Moving forward. These are all real, tangible benefits, tangible means whereby mindfulness can actually impact this mind-body relationship. Mindfulness changes short-term gene functioning, including improving energy metabolism, mitochondrial function, insulin secretion, telomere maintenance, and decreasing the inflammatory response as well as stress-related pathways. Moving forward. So I'm going to just, I get a lot of questions about medical cannabis, and, you know, especially in the state of Florida, very unfortunately, medical cannabis is a misnomer. Unfortunately, a lot of the formulations that were studied in clinical trials are not the ones that are available in the medical cannabis dispensaries. So medical cannabis in itself is kind of a misnomer. But I must mention it because many, many patients ask about it, and I refer you to this guideline from the American Academy of Neurology. This is the question of whether marijuana produced from the flowering top of the hemp plant Cannabis sativa should be used for the symptom management of multiple sclerosis. Well, it's a complex question. Generally speaking, we use a very less is more approach when it comes to all herbs and vitamins and supplements. But we are, on the flip side of that, we are, I think, the only physician practice at the Memorial Healthcare System. We do authorize medical cannabis in the palliative care setting for our cancer patients. And there are known benzodiazepine and opioid sparing effects for those patients who are feeling really negative side effects from these other medications. Medical cannabis can be used to ameliorate some of those untoward effects. Moving forward. So nabiximols actually have been studied significantly. These are oral sprays derived from cannabis. Unfortunately, these are not the ones that are available in the medical cannabis dispensaries. So again, very, very useful when it comes to addressing the spasticity-related side effects of MS. And I think further research is still cooking, so do stay tuned. Moving forward. Moving forward. So again, a lot of these are, please forgive the wordy slides, but suffice it to say that this research is being done, unfortunately, because of its classification as a Schedule I drug here in the United States. Cannabis has the effectiveness and safety data has been really curtailed because the research is not able to be done as long as it is still maintaining that Schedule I classification. Moving forward. So we embody those positive health behaviors for our patients. I think especially during the last year and a half of this pandemic, provider health, nurse health, physician wellness, employee health have been incredibly important. And Memorial, I'm very proud to work for a health system that really has made a concerted effort and a considerable investment in supporting how we heal the healers. How do we take care of the health of those individuals who are on the front lines and taking care of patients, both with MS as well as other chronic medical conditions. So this is wonderful, and it's very, very important, especially in the context of what we've experienced collectively over the last 18 months or so. Moving forward. And I'll close with this slide, which is the rationale for the wellness model in MS as well as other chronic medical conditions. It's from Daniel Siegel, who wrote The Mindfulness Therapist in 2010. It says, research suggests that our presence as medical or mental health clinicians, the way we bring ourselves fully into connection with those for whom we care, is one of the most crucial factors supporting how people heal and how they respond to our therapeutic efforts. And I think that's a very eloquent way of really encapsulating the integrative medicine approach. Moving forward. Thank you all so much for your keen attention. I really appreciate everybody's attention and interest. Please, I look forward to your questions.
Awesome. Thank you very much. Thank you very much. I'm applauding you for all the people that are online. All right. Great topic. Great conversation. Before I get into your questions, and we do have quite a few, I want to welcome first all the people that signed in after we got the program started. I do thank you for being here. My name is Stuart Schlossman. I am an MS patient, and I'm also the president and founder of MS Views and News. And I am an MS patient first, so I do understand a lot of what everybody is living with, okay? So in addition to that, I wanted to let all the newcomers know that we have handouts. And if you use the scroll bar on the right side of the screen, there's a handouts. It says the number 2 next to it. If you click on the word handouts, you'll see what's there. It's a copy of our program agenda as well as our journal for this event. So you'll have that information. Additionally, I just want to mention that for anybody that wants to ask questions during this program, please keep everything relevant to what the topic is that the speaker is talking about. Please do not ask about things that it's impossible for the speaker to answer. Also know that there is nothing for this program concerning mental health. For anybody that has asked questions already about mental health, please know that it will not be answered during this program, but we do have a mental health series. You would have to go to the MS Views and News website. You can find that by going to msvn.org, or you can access this on Google. And one last thing, for everybody that's wondering how they're going to remember everything that's on here, because it's not possible to remember, especially all the slides that you will see, this program will be published to our YouTube channel within 1 week, okay? And you will be able to see or go through the slides again, listen to the speakers again, and share this with your family and friends. So that being said, now it's time to ask Dr. Mehta some questions. All right, we have questions from online. Please know that for whoever I see a name with a question, I am going to say your first name just so you can feel happy that the person is answering your question. Please know I'm not mentioning any last names, and please know that unless you have a very, very strange name similar to a name that I use when I say these things, and that's Aloysius, I will not say your name if your name is Aloysius, all right? Because that's too easily identifiable. All right, but first, I have one from Kathy. Kathy is asking, or Kathy is even saying that she would love to go to a functional medicine practitioner, but it seems unaffordable and quite expensive since she hasn't seen any that take insurance. Can you tell us about that, please?
So it's Kathy, very good question, and I appreciate your concerns. Unfortunately, you're absolutely correct. Many of the modalities that we offer do incur an additional out-of-pocket expense for our clients. I also would like to caution you, Kathy, because oftentimes what ends up happening is that many practitioners who are flying the flag of an integrative approach or a functional medicine approach end up doing a lot of laboratory tests. And this testing is important. We do testing, and it's important. But oftentimes, unfortunately, the technology to do this laboratory testing is available. However, the science that we would require to really understand what the results mean and how the results can be managed is still cooking. So do be careful when you go to people who are flying the flag of an integrative approach or a functional medicine approach. If you're incurring an exorbitant out-of-pocket expense, it is not the place for you. Really, a true integrative approach means a coaching on low-cost, non-pharmacologic methods that really appreciate quality of life and positive health behaviors in the context of improving symptoms. So remember, a less is more approach is oftentimes the one that's most effective because that's the one that's really sustainable. Remember, if you're paying too much out of pocket, it's not going to be sustainable for you. And so do bear these things in mind when looking for a integrative practitioner. And I also empathize that insurance companies are not paying for these modalities as yet. But as we move further into the sort of the value-based payment model, look for a lot of these modalities to become more and more standard of care. So I appreciate your comment, but again, I'm optimistic that in the changes that we're experiencing in healthcare are going to set the tone for improved reimbursement models for some of these modalities that I've mentioned.
Great, thank you for that. For everybody that's listening, please know that we only are doing Q&A with Dr. Mehta for 20 minutes. So we are going to be flying through some of these questions. And if it's a yes, no, he's going to answer just yes, no without an explanation. Okay, so next up, Lisa's asking, is it possible for like you or a person of your credentials for you to be a primary care physician?
The answer is no. Unfortunately, the therapeutic rapport that we require there's so much to be done. We don't actually serve as a primary care capacity. We encourage our patients to maintain that rapport with their primary care physicians so that they can do some of the other preventive health, address some of the other preventive health concerns while we use the integrative approach first and foremost. So we're considered a subspecialty area.
Thank you. Is there a particular kind of diet recommended for people with multiple sclerosis?
Yes, we use the anti-inflammatory approach because inflammation is such an important and prevalent factor that underlies many of the symptoms that our patients are experiencing with MS. We use the plant-based and anti-inflammatory nutritional approach, which I've described in my talk, which is more plant-based foods and less dairy, less processed foods, less sugar, and less animal protein.
Okay, great. Thank you. Are there any specific alternative medicines or techniques to treat spasticity, such as acupuncture?
Yes, acupuncture has been useful to treat pain related to spasticity, and we use it as an adjunct in our clinical practice very commonly. I would say it's one of the more evidence-based modalities when it comes to these types of treatments. Acupuncture has been shown effective in treating spasticity and pain-related concerns. So yes, the key is to find an acupuncture practitioner with whom you have a good rapport. And again, there's a genetic predisposition to responding to acupuncture. So if you're not responding within just a few sessions, you either need to switch practitioners or choose a different modality.
Thank you. Can you share information briefly, please, about people who use healthy lifestyle as a medicine versus using a disease-modifying treatment?
So again, I want to get into this. I want to be very clear that we are not alternative medicine. It's not an either-or type of decision here. You will be using your medication, which has been prescribed by your neurologist, and typically we've won the hearts and minds and trust of our neurologists at Memorial, and they trust us that we're not going to be discouraging them from using their disease-modifying medications. We are going to be using those medications, and in addition to that, using lifestyle behavioral methods of improving quality of life. So remember, it's not an either an or, it's an and.
Great, thank you. This next question is definitely for you, but maybe also for our last speaker of the day. Are there any natural health items to improve energy and focus, as well as help with one's libido?
Yeah, those are oftentimes interrelated. And what oftentimes happens is that when it comes to libido, our bodies are really incredibly intelligent about how it appropriates and reappropriates resources. So blood flow is of fundamental importance. All of the things that we talk about actually improve blood flow, whether it's aerobic exercise, good sleep practices, all of these things improve blood flow. Unfortunately, for those of us who are experiencing sleep loss or chronic pain or any other types of debilitating symptoms, all of these are biologic stressors. So when we're experiencing biologic stressor, our needles get stuck on the fight and flight end of the spectrum, the sympathetic end of the spectrum. And so acupuncture, exercise, good nutritional practices, all of therapeutic yoga, all of these are instrumental in getting that needle unstuck from the sympathetic end of the spectrum and allowing the needle to flow towards the parasympathetic end of the spectrum, which is really involved with the healing response, that is rest and digest. So good sleep, good digestion, and sexual functioning are all on the parasympathetic side of the spectrum. So all of the things that we've talked about actually help improve libido, and I hope that sets the table for a wonderful talk that you're going to hear later on in the program.
Thank you for that. All right, next, has nutrition shown to improve primary progressive MS?
So, oftentimes, again, what we focus on is addressing the symptom cluster. The symptom cluster is so often related to an inflammatory burden in the body. So whether or not it's actually making a change, whether these positive health behaviors are making a change in tangible, objective lab data, or whether it's just somebody's feeling better. So don't get sort of lost in the weeds with regard to what these positive health behaviors are doing. If you're feeling better, if you're feeling more in control of your mind, of your physical and mental health, and your positive health behaviors are helping move the needle in a positive way, then suffice it to say that you don't need all that testing to really ensure effectiveness of treatment. Again, the goal is to treat the human being and not to treat individual lab results, and that is a fundamental principle of an integrative approach.
Great, thank you. So there are several different people asking different questions to do with exercise, yoga, Tai Chi, and other things concerning for multiple sclerosis. What can you answer about all of the above with regard to this?
I will say that when it comes to positive health behaviors sticking to our lifestyle, there are three components that are very important. Number one, you have to understand why that practice is good for you. That's our job. We're part motivational speakers, and we're part educators, and we're part problem solvers. So you have to understand what is going on in the body that is positive for you. And number two, you have to enjoy that practice. So whether it's therapeutic yoga or Tai Chi or an aerobic exercise routine or resistance training, typically we're good at what we like and we like what we're good at. So it's very important that you use these components. The third thing is it's got to be accessible to you. It has to be accessible to you from a time, resource, money standpoint. So these are the three components that lend themselves to sustain positive health behavior. So don't get caught up with the modality. Find one that you enjoy, understand how it's beneficial for you, and make sure that it's accessible to you and be able to incorporate it into your daily and weekly routine. And that's what's going to provide you with a lasting benefit.
Great, thank you. You might have answered this while you were speaking, but I'm not sure. Phyllis is asking, I've read that acupuncture can be helpful to mediate MS symptoms such as pain and tingling and incontinence. What can you tell us?
So it is very, again, acupuncture is a really important complementary modality that we apply in our integrative program in Memorial Health. We have two wonderful, just innate, intuitive healers who are acupuncture practitioners in our program. And acupuncture, as you correctly described, Kathy, acupuncture is very useful when it comes to neuropathic symptoms. And now we haven't necessarily used it for incontinence per se, but these are anecdotal. There are anecdotal reports that it can be helpful. And this is typically it's never an isolated recommendation. Typically, acupuncture, we use it in combination, in collaboration with all of the other things that we've talked about that comprise an integrative approach.
Okay, thank you. Joy is asking, any comment on plant medicine MS? Research shows effective in depression, PTSD, and others.
So you're absolutely correct. I mean, plant medicine is a vast subject, and there are so many things in the plant kingdom that are useful to reduce the inflammatory burden in the body. I talked about turmeric and the curcuminoids. I talked about the catechins in green tea. It's really an exhaustive subject, but we do use we do use plants and herbs, sometimes even in the supplement form. And when we do so, it's very important to monitor herb-drug interactions. So this is a very important point. Is that oftentimes the supplements that are out there are of inferior quality. So it's important that you use plant. If you're going to use supplements that contain herbs, it's very important that you get it from a very reputed manufacturer. There are three criteria that we use: authenticity, purity, and potency. Authenticity, what's on the label is in the product. What's in the product is on the label. Purity, it's void of any microorganism contaminants or heavy metals or organic solvents used in the manufacturing process. And potency, the number of milligrams in the product is actually what's on the label. So authenticity, purity, and potency, and that's how we guide our green pharmacy. We have a online dispensary, which we call a green pharmacy at Memorial, where only the top quality plant-based herbs and supplements are used in a very judicious and evidence-based way, and we monitor herb-drug interactions, and we research herb-drug interactions before putting patients on these plant-based approaches. So I'm glad you asked the question, Joy. Thank you.
Thank you for that. So we have about 6 minutes remaining for your segment, and we have about 8 questions to go, so I'm just letting you know, okay? All right, first one is Marianne. How do you know which directions to go first with an MS treatment? I think she might be referring that, are we doing healthy lifestyles like what you're talking about, or an actual DMT?
No, I would say your first stop is to get in with a MS specialized neurologist. It's incredibly important not to wait because oftentimes what we find is that if you wait too long for using the standard of care medical management, sometimes the integrative approaches are less effective. Remember, integrative medicine is not to be used for any acute process. These are all modalities that are very complementary to disease-modifying therapies. So I encourage you, do not pass go, do not collect $200. Go straight to your neurologist, and then come to your integrative practitioner who can coach you as to how positive health behaviors can work in tandem with that DMT. Good question, Marianne.
Good, thank you. Now, Tammy's been waiting since the very beginning. She was one of the first questions asked. So I'm going to get to that right now, all right? If the beta cell in my brain keeps me from sleeping, is there anything you can recommend outside of biofeedback therapy?
So biofeedback is a wonderful therapy, but remember, when it comes to mind-body practices, there's such a vast array of mind-body practices. There's creative visualization, guided imagery, affirmations, breathing techniques. I have clients who are knitting while doing their moving mindfulness practice or walking meditation. You got to find one that works for you. So if biofeedback hasn't been effective, you have to quickly switch to another modality that you enjoy, that you can appreciate the benefits of. Remember, if you enjoy the modality and you appreciate the benefits, that's what's going to make it stick to your lifestyle. Integrative medicine is slow medicine. Modern medicine is fast medicine. When you combine the fast medicine with the slow medicine, you get the integrative approach. So if something's not working for you, it's important that you switch to a modality that you can enjoy and appreciate, because it's the sustained application of these positive health behaviors that's really going to serve you well in the long term, Joyce.
Thank you very much. So just a quick reminder, for after Dr. Mehta finishes here, we are going to be continuing on with Dr. Beatty, and she will be speaking about things to do with multiple sclerosis. So if you have any MS-related questions coming up, she would be the one to speak with. All right, next, and this is probably a big subject, though, but I need you to keep it short. What do you recommend for supplements? Which ones for those living with MS?
So again, it's a very individual approach. We don't use a blanket supplement algorithm for everybody. It needs to be very, very individualized. It's related to what other medications they have, what other chronic medical conditions they have. So I would be hard pressed to share what supplements we use. But I do think that Dale Bredesen and his Recode Protocol is a really great initial starting point. If you read that document, if you read his research, it's really it draws. Our practices draw heavily on his work.
Okay. Is there any DNA testing that can be used for this? Yes or no?
So again, no. The honest answer is a real fundamental principle in integrative health is to treat the human being and not individual lab tests. So just if you're feeling better, it's working for you. If you're not feeling better, we're going to try a different approach.
Okay, last question for you. How much REM sleep should one get?
This is a very good question. REM and stage 3 sleep, or how much time we spend in those deeper, more restorative stages of sleep, are oftentimes related to our subjective sleep quality. So don't perseverate on a hard and fast number of how long you're going to need to be in deeper, more restorative stages of sleep. Just ask yourself two questions. Number one, are you waking up on most mornings feeling refreshed? And number two, do you have enough energy to get done when you need to get done during the day? And if the answer to those two questions is yes, congratulations, you don't have a sleep concern. If the answer to those questions is no, then you may need a sleep evaluation. Thank you again so much for your time and enthusiasm. I really appreciate the opportunity to be here with you all today.
That's awesome. Thank you for joining us.